Hi, I'm Melody Carter, the Assistant Dean of Undergraduate Programs at the Capstone College of Nursing at the University of Alabama. I will present the first half of the admission of 3 undergraduate nursing student cohorts, strategies utilized to overcome challenges presentation.
Hello, everyone. My name is Haley Strickland, and I serve as the traditional BSN coordinator and teach in undergraduate programs at the Capstone College of Nursing. I will be presenting the second half of this presentation.
The Capstone College of Nursing has a lower division consisting of core curriculum and prerequisite courses prior to being promoted into upper division. This is a competitive process. Previously, the Capstone College of Nursing admitted 112 students in the summer and fall each year. However, we were finding that numerous qualified undergraduate students were not promoted to upper division due to limitations of 2 cohort admission cycles. We were getting pressure from our external and internal community of interest to promote more students into the upper division. The purpose of admitting a third cohort of undergraduate nursing students was to provide more opportunities for qualified nursing students to become baccalaureate prepared nurses at the Capstone College of Nursing. Many of our students wanted to graduate from the University of Alabama with a BSN degree. Some students would wait for another promotion cycle, but we were losing many qualified nursing students to other majors or they would leave the university. Another factor we considered was many of the colleges at the university were experiencing decreased enrollment, but nursing was seeing an increase in student enrollment in lower division. Higher administration and our internal and external community of interest requested we promote more students into the upper division nursing classes. One strategy for solving the nursing shortage is to increase enrollment in undergraduate programs in schools of nursing. The idea of a third cohort was first introduced in the Undergraduate Education Committee. I shared the numbers of students that were eligible that did not get into upper division and some emails from students without sharing their names who were not promoted but really wanted to graduate from the Capstone College of Nursing. The Undergraduate Education Committee voted to take the third cohort admission forward to the Undergraduate Faculty Committee the following week for discussion. When I brought the idea forward to the entire Undergraduate Faculty Committee, most of the faculty were positive about the possibility. However, they did recognize some challenges to promoting a group in the spring. One of the biggest challenges was teaching clinicals in the summer and classroom space. Since we are firm believers in faculty governance, we asked for a task force to be formed to review the possibility of admitting 3 cohorts into upper division. We had 9 faculty volunteer and 1 agreed to chair the task force. In addition, 3 staff members volunteered to help with possible planning during their monthly committee meeting. So the task force consisted of 9 faculty and 3 staff. The task force met every 2 weeks to look at classroom size, clinical expansion, and other changes that would occur based on the possible increase in students. A staff member devised a schedule for rotating classes, and faculty worked on creative strategies to rotate students through their coursework. The task force recommended admitting 40 additional students in the first spring promotion cohort. They wanted to keep the cohort size small to work through the process. As the Assistant Dean of Undergraduate Programs, I participated in the task force. I followed the three ABCs to ensure that faculty and staff owned the changes we would make if we decided to admit an additional cohort. We all focused on honoring our policies to provide consistency in decision making, and we supported faculty governance during the changes. Affected faculty and staff were included in the decision making. We strategically included faculty and staff and recognized their efforts during the process. We continually mentioned how much we appreciated individuals' contributions, and the faculty and staff facilitated the process. The chair of the task force communicated updates regularly with emails and during meetings. The effective communication about updates fostered a positive, productive climate because faculty and staff had input in the decision-making process.
There were many challenges to overcome throughout the initiation of this change, one of which was teaching clinical in the summer. Up to this point, clinical rotations only occurred during the fall and spring semesters. Implementation of summer clinical rotations required additional clinical placements and faculty interested in this teaching assignment. Students in the new spring cohort eventually merged with the previous fall cohort of students when they got into their third semester of upper division. This created a very large cohort of students which presented a challenge in regards to classroom space and instruction. Staff were instrumental in reorganizing the existing classroom schedule to make room for this large cohort of students. The faculty who teach third semester courses develop creative teaching strategies, some of which utilize small group sessions to maintain an optimal level of quality instruction. A successful testing plan was initiated by utilizing additional faculty and IT staff to simultaneously test in multiple rooms. As mentioned previously, classroom space availability was examined as well as instruction time in our clinical practice lab. The faculty were willing to adjust their classroom, lab, and simulation time to make the addition of the new spring cohort successful. As the large cohort of students progressed through the program, additional clinical placements in specialty areas were needed, as well as experienced adjunct clinical faculty. Then COVID-19 hit, as it did everywhere, and our plans for this past summer had to change. These changes included our fundamentals course not being able to be taught over the summer term, which led to the cohort merger occurring in semester 2 within fundamentals instead of our semester 3 courses. Once again, our faculty stepped up to the plate by creating innovative teaching and learning experiences for our students virtually and in person in small groups in our simulation and clinical practice lab. What made this change even more complex is that our building is currently under construction, but with true nursing spirit, we adapted and overcame. While the addition of the third cohort presented many challenges, we viewed this as a prime opportunity of growth for the college. With the vast majority of faculty on 9-month contracts, the university approved several 12-month positions to provide coverage for summer clinical rotations long term. Enrollment growth also led to the university hiring an additional academic advisor to support the students in the College of Nursing. As I mentioned previously, our building is currently under construction. We are very excited that our building expansion will include several large classrooms, which are big enough to accommodate our large cohort of students. Our clinical practice lab, as well as simulation center, will also be expanding to accommodate our growing enrollment. A large student lounge and multiple quiet study areas are housed within this new expansion. New faculty offices and meeting spaces will also continue to support the future growth of the college. Even through these uncertain times, we are dedicated to the growth of our college and the profession of nursing. We appreciate your time and roll tide.